Dela Paz, and I am a student from Nueva Ecija University of Science and Technology. So today, I will perform to you on how to do the Logrolling and positioning of the patient or client. What is Logrolling? Logrolling is used for the patient who must be turned in one movement without twisting. The purpose of Logrolling is to maintain alignment of the spine while turning and moving the patient who has or had spinal surgery or suspected or documented spinal surgery. It requires at least 2 people. What is positioning? Patient positioning involves properly maintaining patient's natural body alignment by preventing hypertension and extreme lateral rotation to prevent complications of immobility and injury. Before we do the procedure, we should assess the following first. The first one is physical abilities, ability to the client to understand the instructions. Number 3 is the degree of comfort, the client's weight. Assess for our own ability and strength to move the client. Determine the assistive devices that will require in the procedure. Determine such inconveniences such as IV pole or the heavy cast. Medications that a client is receiving. And the last one is the assistance of the other healthcare personnel. The materials that is needed in the procedure is the pull or the turn sheet. Stand up near the client's bed while the side rails down. Since I'm in this side of the hospital bed, I will take down these side rails of the hospital bed. And the other side rails of the hospital bed will remain up because there is no one that is assisting the patient. Before approaching the patient, we should always remember the word give. G stands for greet the client and I stands for introduce yourself to the client. Hi, my name is Princess Dela Paz. I am a student from Nueva Ecija University of Science and Technology. V stands for verify the client or identify the client. There are many ways to identify the client such as door tag names, wrist tag, bedside name tag, IV tag or IV pole tag, and patient's chart. But the most or easiest way to verify or identify the client is ask your patient for verification. May I know your name? Do you mind if I know your birthday?
No, December 5.
Then, how should I address you? And letter E stands for explain to client what you're going to do and why it is necessary. Today, I will be doing positioning of your body. Specifically, I will be doing Logrolling. It's used to decrease any pressures from your back, especially or specifically on your spine, and it is used to minimize any presence of pressure ulcers in your back. Is it okay? Close the curtains of the bed to provide privacy. Provide client's privacy. Review the chart for any health problems that would affect the patient. first thing that we need to do is wash our hands or do the proper hand hygiene to prevent the possible transmission of other microorganisms. And to formally start the procedure, for now, I will do a proper hand hygiene. It is used to eliminate all possible bacteria and germs that can interfere with the process. Bring the equipment near the patient. Perform hand hygiene and put on personal protective equipment if necessary, but we are only doing log rolling and positioning of the client, so therefore, wearing PPE like gloves is not necessary. If the client is heavy, call your colleague or your co-nurses to help you to lift the patient. Now, I am here with my colleague to help me in doing the process. His name is Dela Paz. Can I ask if you feel any pain? Can you roll down your blanket? Roll the turn sheet to the client carefully. Ask your client if they can put their arms across to their chest, and if they can't, you yourself will put your client's arm across to their chest like this. Before we start, can you cross your arms in your chest like this?
Yes.
And to prepare lifting the patient and to observe your proper body mechanics, your dominant foot will step ahead or forward and your non-dominant foot will step backward to support yourself in lifting the patient. Now, we will lift the client to your side, okay? So please, your dominant foot will step forward and your non-dominant foot will step backward so that we can observe our proper body mechanics, okay? Hold the turn sheet beside the client's hips and near the shoulder. And as you count your numbers 1, 2, 3, both of you and your colleague will gently lift the patient to the other side of the bed. Okay, now let's start. In the count of 3. 1, 2, 3. Fix the turn sheet. Put the pillow on the client's leg to support the upper leg when the client is turned. Your colleague or your co-nurses who is in the back of the client will push the client while holding their shoulders and tight, while you, who is in front of the patient, will pull the client holding her hips and upper extremities. And now, I will put this pillow in your leg so that it can support your upper leg. I will turn it slightly, okay? Yes. So now, we will turn you in my side. Is that okay? I count of 3. 1, 2, 3. Ask your colleague to hold the client while you are getting the pillow. And put the pillow into the client's back to anchor the body of client and to prevent the supine position of the client. Now, I will be putting a pillow in your back so that it can avoid for your body to be in the supine position. Get another pillow and put it into the chest part of the client to prevent the pronation or the prone position of the client. And now, I will put pillows in your front so that you can avoid or your body will be avoided to be in the prone position. Are you na comfortable? Okay. Thank you for your help. Ask the client if they are comfortable and perform the hand hygiene again to prevent your possible contamination or transmission of microorganisms to the outside or from the outside of the room. Now, I will bring back your blanket so that you will make yourself more comfortable. Now, I will perform proper hand hygiene so that we can prevent the future transmission of germs and bacteria to my other nurses and co-clients. Thank you. Always remember to document the following: the time and position of change of the client, signs of pressure areas, the use of support devices, and the last one is the client's response to moving and turning.